Notice being given, or that you may have the experience of giving, is aspirin, acetylsalicylic acid, or ASA, commonly referred to. Keep in mind, this helps prevent platelet aggregation. Aggregation is just a big word for saying platelets from sticking together. Also, another medication that does a similar job but is more specialized is called Plavix or clopidogrel. We want you to be familiar with both aspirin and Plavix. They promote bleeding by prolonging or inhibiting platelets from sticking together. Typically, we use this when we want to prevent a blood clot, and clients have had a history of recurrent stroke. That's the ischemic kind, not the hemorrhagic kind. Or they've had a heart attack and they need to be on medicine if they've received some sort of stent, or if the doctor may just determine that they want to reduce the likelihood of a second heart attack, and they'll discuss this with their client and determine whether or not they need to be on it long term. The adverse effects that we're watching out for, you'll notice that two are bolded and italicized, so those are common, and you'll want to watch out for them. Rash may happen and a cough may happen, and you'll want to be on the lookout and listen for any clients that might complain of a rash or a cough. Always be asking yourself whenever a client complains about something, have they started any new medications recently? So acetylsalicylic acid, that's the other medication we're looking at here. This is a brand version of the same medication. It's Bayer. Quite often clients will be put on low-dose baby aspirin to help prevent platelets from sticking together. This is helpful in preventing a heart attack or a stroke. Again, the ischemic kind, not the hemorrhagic kind. And it prevents blood clots from sticking together. We want to watch out for blood in the stool. Sometimes that is very visible and frank red or black and tarry. Sometimes it's hidden in a small amount. We don't really notice it, so you really have to ask clients what color of their stools. You want to assess that. There's a big fancy word for blood in the stool, and I hope you already know what that big fancy word is. It starts with an M. It's a very pretty name or pretty word. But you also want to watch out for ringing in the ears. I challenge you to go find out what the medical term is for ringing in the ears. When you're completing your drug template guide, you'll notice that it says report any signs and symptoms of ringing in the ears. And so when you're filling these templates out, look for the bolded and the italicized terms, and then look at the teaching points and see if they link up in any way. Thrombolytics, although we won't be expecting registered practical nurses to administer thrombolytics, I think it's important that you're aware of what they are and when clients receive them. So thrombolytics are a very powerful, dangerous medication. They are given when a clot is already known to exist. So if someone has a deep vein thrombosis, you wouldn't be reaching for warfarin or heparin. Those medications will help prevent a clot from developing. What you really are reaching for is a thrombolytic. That's a medication that goes in, and if you look at the last name, lytic, or the suffix, it's going to kill or break up or destroy. So it dissolves any existing clots. It converts plasminogen to plasmin again, so it circulates. It's most effective if given within a 4-hour window. I would star that. I think it's important to note that the longer a clot sits somewhere, the less likely it is to be able to respond to the thrombolytic. These are very dangerous medications, and it's really important. Like if someone's in a car accident and they received a thrombolytic, or if someone tells you that they had a thrombolytic and they're going for surgery in the not too distant future, these are, or they had surgery in the recent past, these are very important things for nurses to note and communicate to the healthcare team. So can you imagine if someone had surgery a week ago on their knee, let's say, and then they had a heart attack and they needed a thrombolytic. They actually could not get a thrombolytic because their knee surgery is still fresh. And if you give them a thrombolytic, the knee surgery would develop a bleed. So this is the medication that they talk about as a clot buster. And again, we're not going to talk in great depth about this, but I think it's important for you to remember that thrombolytics are clot busters. They typically end in words like ase because they are an enzyme, streptokinase, among other things. So you can look at your book and read a little bit about that. Laboratory testing, very important for you to understand activated partial thromboplastin time, or APTT, or sometimes abbreviated to PTT, prothrombin time, PT, and international normalized ratio. These are all ways that they're consider them stopwatches. These are ways that we measure the clotting cascade, or aspects of when the clotting process begins. So if we give these medications like heparin, or aspirin or warfarin or whatnot, we would expect an increase in bleeding, so a decrease in clotting. I think that's a very important for you to appreciate. The longer it takes to clot, that increases the time of seconds. So therefore, the value goes up. You'll notice right here in PTT, a normal value is 25 to 40 seconds. A therapeutic, if you are going to give an anticoagulant like heparin or Lovenox or enoxaparin or anything like that, you want to elevate or delay the time that it takes to clot. So it's okay for it to be 1 or 2 times the client's baseline, but we don't want it to be any greater than that. Okay, any greater than 1 or 2 times the client's baseline, and your client will be at risk for bleeding. And all of these studies, the same. We don't expect you to. Actually, we do expect you. So I think it's important for you to appreciate that PTT, the normal value, is 25 to 40 seconds for you and I who aren't taking anticoagulants, and that it would be elevated, delayed, or increase or take longer to clot when you're on these medications. Okay, but the key is that it wouldn't be greater than 2 times the client's baseline. International normalized ratio, often referred to as INR, is drawn whenever a client is receiving warfarin or Coumadin. Sometimes we have to draw this on a daily basis when clients are first started on warfarin, and we might even adjust their warfarin or Coumadin dose based on their INR, but the normal INR value is 2 to 3.5. If it is greater than that, your client will probably have signs and symptoms of bleeding, and you would want to watch out for signs and symptoms of bleeding. Moving forward, the role of the nurse with anticoagulants. Again, this all comes from your nursing process. I believe that's on page 337. So very important for you to spend some time understanding what we as nurses will do when a client is prescribed an anticoagulant, or we know that they've purchased or acquired an anticoagulant from or received an anticoagulant from a healthcare provider. We're going to pay attention to their complete blood cell count. That's a CBC. I'm wondering if you recognize what part of the CBC is very important to pay attention to if the client is on heparin. I'll repeat that question. What part of the CBC is important to pay attention to if the client is on heparin? All right. Also, we want to watch for any other signs of internal bleeding, such as lumbar pain or pain in the back area, or a flank area where the kidneys are. Any kind of abdominal bulging, that might mean that there's an internal abdominal bleed. Guaiac tests of the stool. So Guaiac, that is well, you can watch the video on it. I will post one on Blackboard, but that allows you to determine if there's occult or hidden blood in the stool. So sometimes you can see blood, and it's black and tarry, and other times you can't see blood, but it's still there. It's microscopic. We still want to know if that exists. So if you're not sure, you can easily grab a Guaiac test and determine if there is any blood hidden in the stool. Very important and essential for patient safety to monitor coagulation studies. So if they're going to be on any of these medications long term, you're going to expect them to have lab tests ordered. Also, patients who are going to be on this long term may want to consider wearing an ID bracelet that identifies them as being on anticoagulant therapy. Very important for paramedics or the emergency department should they go in there and not be able to communicate. All right. But they're not obligated to wear one. We just encourage them. So if in the event they were ever unable to speak, we would know that they're receiving some sort of medication. Again, further to our role as a nurse, do not give warfarin to pregnant clients. I don't know how many times we can stress it, so that's pretty important. Any anticoagulant or antiplatelet increases the risk of bleeding. So watch out for signs and symptoms of bleeding. If I sound like a broken record, it's not because I'm confused. It's because I'm stressing a very important point. So if you haven't written that down, it would be wise. Heparin and low molecular weight heparins can be given to pregnant clients. So that is what you would expect a pregnant client to be given. You're going to monitor their intake of vitamin K if they're taking what medication. Hopefully you said warfarin. And we're going to limit their intake of garlic due to garlic's ability to cause anticoagulation. So people that are on garlic, garlic already has that ability. So the two together are very synergistic, or they do the similar things, and they really put your client at risk for bleeding. Monitor any gastrointestinal upset. And if for some reason they do bleed, you really do want to apply pressure a little bit longer at that site than you normally would. All right, let's check your understanding. Optimal APTT during therapy is considered A, B, C, or D. Go ahead and, if you're not, give yourself a guess and rewind this video a little bit and have a look at the lab test to come up with your own answer. The term LMWH, when you see this in a test question or on an order set, you're going to hopefully say, I'm pausing because I want you to give you a chance to say low molecular weight heparin. Can you give me an example of a low molecular weight heparin? Hopefully you just said it out loud. Now, what are some health teaching points that you might consider with low molecular weight heparins? They might say, why can't I just have heparin? And you would want to educate them that this medication is actually considered safer. Hopefully you know the antidote for a low molecular weight heparin. Hopefully you know what lab test to look at in the, and if you said CBC, congratulations, but what part of the complete blood cell count are you going to pay attention to when a client is on heparin? And what signs and symptoms do you want your clients to report to their physician or nurse practitioner immediately? All right, I'm going to stop there and create another video for chapter 28.